counseling services to the youth through utilization of an online counseling application developed by the youth, Kelvin Joroge. This intervention is preferred by the youth for the reasons that if used, it is easy, convenient, confidential, cheap, and accessible from a personal phone. This initiative has since seen increases in the number of the youth accessing counseling services, which help to mitigate mental health challenges. Through collaboration between the Ministry and International Youth Fellowship, Korea International NGO with presence in 105 countries worldwide, currently based at Kasarani and operates satellite campuses across the country, offers mindset changes training which integrates mental health clinic through weekend academy program. Through Kikao initiative and outreach activity in which the ministry in collaboration with other MDS organizes sensitization programs where mobile health clinics are organized for the youth. The ministry, through State Department for Youth Affairs and Creative Economy, has lined up a myriad of collaborative program with Madari Hospital, Youth in College, JQuat, to offer mental health sensitization, screening and referral to the youth in college who may not wish to use the in-college counseling facilities. The ministry also uses the services of the officer in charge of employee wellness to provide on-the-spot guidance on matters mental health to the youth who come to the office seeking information on mental health services. Number 7, sports and arts therapy programs. Initiatives such as sports for development and creative therapy workshops are designed to foster mental well-being through engagement in sports and the arts, promoting resilience, teamwork, and emotional expression. Partnerships with mental health professionals. The ministry collaborates with psychologists and counselors to offer tailored mental health services during youth sports camps and creative arts events. Number 9, public awareness campaigns. Initiatives like End the Stigma and Mental Health Awareness Weeks target young people to promote open dialogue around mental health, destigmatization, and encourage help-seeking behaviors. These initiatives are customers to address challenges such as anxiety, depression, peer pressure, and identity crisis commonly faced by the youth. The ministry also has adopted a multifaceted approach, including embedding mental health services in youth centers and sports federations. 120 operational youth empowerment centers now integrate mental health sessions, including counseling, in their daily activities. The sports federations too have integrated counseling and mental health screening in their programs. Training coaches and instructors, capacity building for coaches and arts instructors on mental health, first aid to identify early signs of mental distress among participants. 3, referral systems, established referral pathways for young people requiring specialized mental health services to public and private healthcare providers. Number 4, wellness programs for national teams. The ministry supports the Kenya Academy of Sports to include mental health modules in athlete development programs, including psychological preparation and post-event counseling. Integrated service delivery model. The ministry is piloting integrated sports and arts programs with inbuilt mental health support services. These are accessible at county youth empowerment centers and during national events like the Kenya Youth Inter-County Sports and Cultural Association Games. Number 2, mobile counseling units. In partnership with the NGOs, the ministry has deployed mobile mental health units to reach young people in remote areas during sports and arts events. Number 3, access channels. Youth can access mental health services through referrals from coaches and youth officers, direct contact with on-site counseling during events, toll-free mental health helplines. The other part of the question, the National Multisectoral Mental Health Action Plan 2021-2025, the ministry is a key partner in implementing the plan, which is led by the Minister of Health. It prioritizes youth mental health through joint campaigns and community outreach programs. Number 2, collaborative awareness campaigns, joint initiatives with organizations like Basic Needs Kenya and the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA, focus on mental health awareness during sports tournaments, training peer education in mental health literacy. Number 3, National Sports Safety Framework, developed with input from the Ministry of Health. This framework includes mental health as a critical component of athlete safety and wellness. And finally, specific campaigns, Mind Your Youth, our youth campaign. This is a joint program promoting mental health awareness in schools and community sports hubs. I beg to submit, Honorable Speaker. Thank you.
Honorable Miraj, you may ask your 2 supplementary questions.
Thank you, Mr. Speaker, sir, and I'd like to thank the CS for a well-elaborate feedback from the questions by Senator Joyce Korir. But for the supplementary, if I may put to his attention, due to the so many land grabbing issues from our region, so many youth facilities, especially the ground.
Which is your region, Honorable Miraj?
Coast region.
You have to state which is your region.
Thank you, Mr. Speaker, sir. From the coast region, we have grounds like Kishada in Kisauni, Mende in Likoni, and Vexula in Likoni, where land grabbers are taking away the grounds from the youths. And this is increasingly adding up the numbers of our youths who are mentally unstable right now. You've spoken to a matter of sports in our schools to help in curbing the mental crisis that we are having from our youths. Can I put to your attention, CS, that most of the schools do not have playgrounds for them to go for sports. I don't know what measures you are taking, because as much as I can remember is that the president had put a task force and a fund to repossess grabbed land from the land grabbers. As a ministry and mental health in the picture, what are the measures you are going to take to safeguard the grounds that are being affected by major infrastructural programs by government and the land grabbers in our region? Thank you, Mr. Speaker, sir.
Honorable CS, you may respond.
Thank you very much, Honorable Speaker. I want to say that I acknowledge the question that has been put to me by Senator Miraji on matters land. And what we are doing as a ministry, we are working very closely with county governments, with the Ministry of Land, and also with Ministry of Education, where schools are concerned, to ensure that, 1, the grabbed land is repossessed, and number 2, to also protect other pieces of land from land grabbers. So that is the effort that we are doing. And part of the program that we are doing on sports academies is part of that program, where once we identify a place where we are doing an academy in a school, we also work with the other agencies to ensure that land is reclaimed, repossessed, and protected from grabbing. So we are working with other agencies of government on that matter.
Senator Catherine Muma.
Thank you, Honorable Speaker, for the opportunity to ask the CS a question. Thank you, CS, for your elaborate response to Senator Korir's question. Honorable CS, what you said sounds so good, but I would want to know where it is actually being implemented. In particular, I would want to know what programs you have in Nyakach sub-county, where I have been for the last 1 month. Honorable CS Nyakach in 2023 had teen and child pregnancy to the extent of 3,816. We have child mothers, we have young boys with a lot of mental health. We don't have any programs in that sub-county community. We don't even have any interventions. I'm trying to work with one CBO, trying to intervene for child mothers who cannot access counseling services and so on. Where are these programs? And why are they not reaching Nyakach sub-county?
Senator Gataya.
Honorable Speaker, I have a supplementary question to last year's sports concerning a stadium in Tharaka Nithi.
Honorable Gataya, kindly take your seat.
What is it, Honorable Speaker?
Just take your seat. Just take your seat. Senator Manzo.
Thank you, Mr. Speaker. Mr. Speaker, I had an opportunity to be a secretary in the Ministry of Youth and Sports. And I want to ask the Cabinet Secretary in this relation to the mental illness of young people. The Youth Fund was set to help those who wanted to set up businesses so that they can self-employ themselves. I've seen an initiative whereby people are fundraising for the youth. What has happened to the Youth Fund? And how implementing it to make sure that we reduce mental illness or depression or stress of young people by making sure that they secure their future through self-employment.
Senator Veronica Maina.
More radio, 88.2 FM. We are in charge. More radio, 88.2